This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh, and we're going to be talking about pelvic floor pain. Now, this is something that can affect up to 4% of the women in the United States, but it can also affect men and children for a variety of reasons. So that's why we're going to sit down with physical therapist Amy Clarke today. Well, thank you for joining us today. We're talking about pelvic floor pain, and I have to be honest, that's something I've never heard of. So what exactly is pelvic floor pain?
Well, I think it's important to understand what the pelvic floor is. And so the pelvic floor is often described as a sling or a hammock of muscle and connective tissue, nerves embedded in that attaches to the front and the sides and the back of the pelvic bones, and acts as a support for the pelvic organs that sit on top of it. So the pelvic organs would be the bowel, the rectum, the uterus in women, the prostate in men. And by contracting and relaxing, the pelvic floor is able to control those functions of bowel, bladder, and sexual function as well. So when there's overactivity, underactivity, or faulty movement patterns in the pelvic floor, it can result in painful conditions. Sometimes you'll even have pain that is referred to the pelvic floor from these deep hip rotators, the abdominal muscles, abdominal scarring, things like that, scars in the area. So it can be all of those things.
What are some of the symptoms that a person might experience that might lead to an eventual diagnosis of a pelvic floor pain?
The pain that may be in the pelvic area generally, it can also be in the genitals, in the rectum, combined with abdominal or low back pain, hip pain. It will oftentimes disrupt those key functions of the pelvic floor where people will have pain with bowel movements or pain with urination. They can have pain during and after sexual activity or even just with arousal. So it can be quite debilitating.
Are there specific causes to that, or is this more of a genetic type of issue?
There's a lot of different causes. Sometimes the causes are more injury or trauma to the area, where it's a very easily identifiable accident, sometimes unfortunately even abuse. In women, it can be a more traumatic birth. Sometimes, though, there is no clear identifiable moment. It just might be with changes of patterning, changes of usage of those muscles and the related muscles, so that those muscles are under more demand, or for some reason they're not keeping up with demand. Sometimes with aging, particularly in women, those tissues will thin out with hormonal changes, and that can create some problems as well, weakness that comes over time. So those can be linked with developing pelvic floor pain.
Yeah, with so many different things going on there, is it easy to diagnose, or how do you diagnose something like this?
Yeah, with the pelvic floor, we will often manually palpate and feel where if there's tension or if there's dysfunction to movement patterns. We use other ways to diagnose the muscle dysfunction, like biofeedback in the physical therapy realm. Certainly, physicians will look for some of those medical issues like endometriosis and things like that. That would be another factor and certainly need to be addressed as well.
Is there a one fix treatment for something like this, or is it a pretty wide range of options?
Right, it is very diverse. We have a lot of tools at our disposal in physical therapy and in pelvic physical therapy. We'll often start with manual work of those surrounding areas, of the hips and the back, the abdomen, and then with more direct means, we might use manual therapy techniques on the pelvic floor itself with internal and external approaches.
You're a physical therapist, so this can be done with just some good hard work.
Yeah, and sometimes actually hard work is almost the opposite. We teach a lot of relaxation. Because that can be a huge part of it. Stress, emotional stress, and other types of stressors, anxiety, depression can all really play a role in how the brain perceives pain.
If somebody's experiencing some of the symptoms that you were talking about, what's the best way to begin trying to figure out if it is a pelvic floor issue?
Well, I recommend a good discussion with a primary care physician or a specialist like OBGYN, gynecology for women. It's sometimes important to treat those medical conditions that go along with pelvic floor pain, either first or in conjunction with physical therapy, and they can refer on to physical therapy as well. Pelvic physical therapy is much more specialized in these types of problems. So many people live with this condition for so long, fearful, embarrassed, not understanding the treatment options, the conservative treatment options that are there for them, and sometimes even frustrated by past failures to not quite get to the area. Maybe they've treated their back and their hips, and that's helped some, but hasn't quite gotten to their pain. And pelvic physical therapy can really help tie that all together.
Yeah, this is some great information. We really appreciate you taking some time with us today.
Thank you.
So if you're dealing with some of the symptoms that Amy talked about and you think it might be related to pelvic floor pain, you can always check with your primary care provider or your women's health provider, or you can certainly give Amy a call at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.